Hello everybody, my name's Nikki, I'm a physiotherapist and I'm here today to talk to you about the importance and the value of keeping physically active throughout your treatment. So firstly, what does physical activity mean? Well, it means very different things to different people and provokes different sorts of emotions in each of us. For some people, it is definitely about the enjoyment factor, and these sorts of images will relate to that. And for others, it can be a bit scary or a bit difficult. And the other images on the right-hand side of the slide show some of the issues that, and some of the barriers that you might face with exercise. And for those of you that are a little bit unsure about physical activity, some of the statements on the screen you might be able to relate to. So thinking about feeling it's too late to start. That's really understandable, but actually the evidence shows it's never too late. And you can make some valuable changes to your health and your outcomes from treatment, no matter what point you start embarking on a little bit more activity. Feeling like you're too busy to fit it in? Well, life is busy and we all understand that. But actually, there are ways of incorporating exercise in very, very small amounts throughout your daily routine as it stands. And so there is a way to fit things in and around what you're already doing. Feeling like you don't have enough energy, and that's completely understandable given the nature of the talk that Juliette's just given. But actually, as Juliette mentioned, there's an overwhelming recent amount of evidence that you can boost your level of energy by actually exerting yourself a little bit more, which sounds counterintuitive, but actually having the polarity between exercise and rest can really, really help. Maybe you just don't like it. Maybe it's not something that you did before. Maybe you're not a sporty sort of person. You didn't do a great deal of moving about before your diagnosis and starting your treatment. But perhaps as well, feeling like it's quite difficult. And those two statements indicate that perhaps we haven't found the right sort of physical activity for you. And by embarking on something that you enjoy, actually, it shouldn't feel too difficult. And the bottom right statement there, feeling like you're worried or afraid. Well, anxiety is a really rational feeling at this point. Worried about perhaps any damage that you could cause is understandable, but actually it is safe to exercise. We've just got to find the right sort of level. And I'm here to reassure you that there is something that everybody can embark on to help them be that little bit more physically active and in the long run help with your overall health and well-being. So thinking specifically about physical activity when you've got a cancer diagnosis, there's a really well-established link between moving more, being that little bit more active, and better health outcomes overall. And as Juliette has already mentioned, there's a recent change in the approach, and we generally tell people now to avoid inactivity, and we avoid saying things like rest is best, because we've proven with the science that it's not the case. And if you are more physically active throughout your treatment, you get favourable outcomes with regards your disease progression and your overall recovery. And this is a relevant statement at any stage of your cancer diagnosis, right from the very onset of any symptoms, through your diagnosis, your treatment, and then into recovery as well. So the positive effects of being physically active or moving more are numerous, and they're really, really well documented in any science literature. Essentially, exercise releases something called serotonin, and serotonin is known as your feel-good hormone. And with this in our bloodstream, we, as it says on the tin, feel better about ourselves. So mood is improved, we get a better sense of well-being in general. But obviously there's the physical benefits of moving more. We know that it can improve your bone health, it can improve your muscle power. And actually through doing those things as well, exercise can become that little bit easier and more enjoyable. There's also good evidence to show that exercise and the release of serotonin can help regulate your bowel activity, improve appetite, and thus improve digestion. And it can also aid sleep. And that's a big thing with fatigue. Obviously, we think about how important sleep is in recharging that battery. If we've exercised or moved a little bit more in the day, then our sleep patterns tend to be better and our recharging of the battery is more efficient. And at the bottom right there, you can see we can improve our strength and endurance with being more active. And every little really does help with this. You don't have to go to a gym run a marathon. If you're not a sporty person, it really doesn't matter. Just adding in that little bit of extra activity during steps of your routine will really, really help with that. And then specifically thinking about in a cancer diagnosis, what exercise can do to benefit you. Well, it can reduce the negative consequences of treatment. So you've probably heard of all sorts of scary side effects from chemotherapy and radiotherapy, which might be part of your treatment plan. But evidence shows that through being a little bit more physically active and moving our bodies more, we can actually reduce some of those. It can reduce additional medical problems. It can also reduce the rate of disease progression and improve overall well-being and reduce recurrence rates. So where do you start with being physically active? Well, the Department of Health advise all adults that we should do 150 minutes of moderate exertion every week. Now, that might sound like quite a lot, but of course that doesn't need to be all in one go, and that can be broken right down, as explained here on the slide. Maybe just 5 lots of 30 minutes of activity, or even 10 lots of 15 minutes, or break it right down into a really manageable chunk, 25 lots of just 6 minutes of moving about within the week. And this could just be small bursts of activity throughout your day, so as simple as standing up and sitting down, short walks, and exercises perhaps whilst you're watching television. You could do something in sitting. And at the moment, with everything that's going on in the world, it is important that we have access to some physical activity in our own home, and these are good examples of that. So what does moderate mean? That's a question I always get asked. Well, it is different for everybody. Ultimately, we don't want too little exertion. We can't be just sat on the sofa doing nothing. But too much, where we feel exhausted, and maybe this might provoke other problems like pain, breathlessness, is obviously too much. So moderate means feeling a little bit short of breath. Perhaps your heart rate is slightly raised, but you should still ultimately be able to hold a conversation. And that level of exertion and the amount of activity to get to that level will be different for everybody. So let's think about some very, very simple ideas for increasing your activity levels and just moving your bodies that little bit more. If you struggle to remember, perhaps set a reminder. Use your watch, use your mobile telephone, whatever you've got around you to just alert you to the fact that every hour in the day, perhaps you need to just get up and have a little move around. Perhaps changing the way you move around. So if normally, if you're out and about, you would take a lift, try taking the stairs instead. Perhaps get up off the chair to walk to the television and change the channel rather than using the remote control. Perhaps if you're talking to a friend or family member on your phone, stand up instead of sitting down, or even walk around. And there are activities around our homes that are really handy for getting us moving that little bit more. So mowing the lawn. Obviously, that is quite a bit of exertion. That might not be quite right for you, but even if you could do a little bit and then the family member or whoever would usually do it takes over, that's a little way to just move your bodies that bit more. And cleaning around the house sounds pretty dreary, but actually a little bit of vacuum cleaning or some dusting is a good way to move our bodies. And other things that we can perhaps think about, maybe outdoors as well, washing the car, simple things. And by increasing our activity with the things that we're already doing in our routine, we don't need to find specific time to do it. There are also activities hidden inside the things that we're already doing. So I've already mentioned cleaning, vacuuming, things like that, but playing with your grandchildren, that might be one. If it's something quite active, then you're moving your bodies quite a bit. Children are hard to keep up with. Walking the dog, if you have a dog or a family member has a dog, or just popping out on a stroll without one and going to the park is a nice idea to just get that little bit more movement into your routine. And the other way to find the time to pop in a little bit of extra movement is what I like to call gap fill exercises. So waiting time becomes exercise time. Any movement that you could do in the time whilst you're waiting for something else, such as waiting for the kettle to boil, you could perhaps do a loop walking around the house. if you're sat travelling somewhere, you might not be able to stand up, but you could probably do some exercises in sitting. And I'm going to show you some examples of those in a minute anyway. And if you're standing queuing for something, you could use that time to do perhaps a little bit of walking on the spot or some mini squats. Anything like that is just a good idea to increase the amount of movement that you're doing. So let's have a go. With that in mind, I'm just going to go through a very basic program of seated and some standing exercises to show you how you can move your bodies a little bit more. So, if you can be sitting down at home, that's great. Those that are able to stand, I'm going to ask you to stand up initially, and we're going to try and sit down as slowly as we possibly can. Now, the slower we do exercises, the more muscle activity we actually have to use. So try not to use your hands if you can, and try and sit down. If you need to use your hands a little bit, just guide yourself back into the chair. And we're going to do that 3 more times. So standing up and sitting down nice and slowly. For those of you that have to remain seated because you need assistance or you're not able to stand, try raising your arms up from the chair instead. And we're going to sit back down. And 1 more. Nice and slowly. Okay, now everybody can do these. We're going to do some seated exercises. So firstly, I want you to straighten out one leg. Hold that leg nice and straight and try and brace the thigh muscles. So we're really, really working those quite hard. And we're going to do some ankle movements up and down, keeping that knee as straight as you can. 3, 4, 5, 6, 7, 8, 9, 10. And you should feel that that has really worked your thigh muscle quite a lot. So we're going to bend the leg, pop it back down on the floor. And the same again on the other side. So straightening out that leg, nice and tight in the thigh, straight knee, and up and down with the ankle. 4, 5, 6, 7, 8, 9, 10. Now our thighs have had a bit of a workout. We might want to shuffle a little bit further back in the chair and just hold on to the chair for a little bit of support for this one. We're going to try and stretch out both legs at the same time. And then just make little scissoring movements up and down. So we're using the muscles on the inside and the outside of our thighs. So these are some good ideas for things you could be doing on a bus, in the car, whilst watching television, that sort of thing. Okay. And then we're going to do some knee lifts. So we're going to keep our leg bent, but lift our knee up more towards our chest. Alternately, keeping the legs bent. And if you want to, you could even uncross and cross your legs. It's quite a nice activity to do. And if you want to make it a little bit harder, you can add in some arms as well. So if we're doing the marching, we can go up and down with arms. That adds in a bit more work for your heart and your breathing. So just be aware, you should feel like your breathing rate is increasing, your heart rate is increasing, but you should be able to still talk. Okay? So those are just some simple ideas. So thinking about where you can access a little bit of extra help, online there's a wealth of resources out there, especially for cancer patients, about moving more. The Macmillan Move More and the NHS Move More campaigns, if you put any of that into a search engine on the internet, it'll come up with reams of stuff to read. There's also a great website called Walking for Health. And the Macmillan website has a huge amount of information, as well as a YouTube channel. And they even provide a booklet and a DVD, which is available from the Focus Cancer Research Centre and the Macmillan Hub in Gloucester Royal. And there are lots of apps as well, and most of which are actually free to download onto a smartphone. Rise and Recharge is a really good one for people who are struggling with their tiredness levels. But there are numerous free pedometers. Some of them actually exist on the smartphones without needing to download anything additionally, or you can get them from app stores. And iPrescribe is a really good app which is free. It takes a little bit of time just to program in some details about yourself, but then it comes up with an idea for an exercise plan just to get you moving a little bit more, and it'll send you reminders for that as well. And around the county, we do have active balance classes. So when they get back up and running, they're a really good thing to join. So just to go through a few top tips with regards to physical activity. Ultimately, if you remember one thing, it's to avoid inactivity, because inactivity has been shown to perpetuate that feeling of tiredness and that fatigue cycle. And integrating activity with your day-to-day routine is a really nice way of not feeling like it's very labour intensive and is taking extra time out of your day. Set yourself some goals. Now, this is a really good way of marking what you're achieving. The diaries can help with that as well, if you plan that in a little bit. And if you achieve those goals, and I'm thinking low-level, fairly short-term goals, then you should reward your achievement for achieving that. And don't be hard on yourself. As Juliet said, it's really important to be kind to yourself. And with any amount of physical activity, it's really important to just very gradually build yourself up. You wouldn't try and run a marathon without doing any training. So if you are looking to improve the amount that you're moving, you want to start low and then build up very gradually. If something feels very manageable, then that's a sign that you could start to increase your levels of movement and physical activity. But if it feels quite hard, stick at it for a little bit longer before trying anything different or anything more. And try and find something that you enjoy. Enjoyment is a huge factor in the energy in that we've talked about. So if you can combine some physical activity with an enjoyment component, it will really, really boost you. And involve somebody that can mark your progress with you, somebody that can boost your morale about it all and share your achievements when you make them is really key. And that needn't be somebody that you actually have to physically see. That could be somebody just on the telephone or via an app or something like that. So just thinking about a few simple take-home messages then. It is better to be active than inactive. Something is always better than nothing, so please don't feel like it's too little or too late ever. And as Mr. Tesco says, every little helps, and it is best for your recovery. All of the science has proven that. As Juliet has already mentioned, please seek help and advice from your CNS or from us as a therapy team if you're worried or if you just don't even know where to begin. And as we ended on last time, be kind to yourself. That's the most important thing. Thank you very much for listening.